Welcome back. You've been watching, up till now, In Time TV's On the Edge, Conversations in Medical Sciences Research. I'm Dr. Jonas Moses, and with me today, Dr. Richard Baltaro. We have been talking about the accreditation of pathology laboratories around the world. We're, in fact, going to talk now about international accreditation. We had just started talking a little bit about the necessity for being able to communicate with foreign pathologists, and no doubt that not only means being able to speak a language, but read that language and understand in that language what the processes are in that laboratory, so that you don't miss anything. Tell me a little bit about what happens when you travel to a foreign lab.
Well, let's take Canada.
Sure.
In Quebec, they speak French, so a lot of their procedures are written in French and English.
Okay.
Because they're
it makes it a little
essentially bilingual. In Mexico, where I was a couple weeks ago, everything is in Spanish. So our team of inspectors has expertise in that area. And sometimes it's difficult to find experts in certain areas and have a language.
Because of the
expertise.
vernacular, sure. It gets fairly esoteric.
And it's very difficult sometimes to find people in all those areas that have Japanese and cytogenetics or histocompatibility, and our inspectors are from all over the world. When we go internationally, typically we have mixed American and other countries' inspectors. They may be, when we inspected in Singapore, we had folks from Korea, for example, and typically they come from other Asian countries as well.
So you get to work with a very, very diverse group as part of your team.
Yes. But we all have, we're all concerned about patients, we're all concerned about standards of excellence, good practices. We are willing to learn a great deal, and we actually enjoy what we're doing.
Typically, what happens when you enter a foreign lab then? Do they have different protocols than American protocols, or are they going? Maybe the government of France has a different standard than the U.S. government. Is this an experience?
Well, we expect them to meet our standards to get our accreditation.
Okay.
They may have additional standards. For example, a very common international method is ISO.
Okay.
And we ourselves have a program, an ISO program.
And that means?
International Société Organisation. Okay. There are standard procedures on how to write procedure, document things.
Such as ISO 9000.
Exactly, ISO okay. 9000, exactly.
Does it now?
Yes. And Canadian labs, for example, are inspected also by the Canadian provinces. And so the laboratories are used to having a lot of people looking at them. One of the reasons is in blood banks, we already have 6 sigmas. We have a very high level of accuracy and precision.
And just briefly explain what 6 sigma is for our viewers.
We have very few people in this country that die from accidents secondary to blood transfusions.
Okay.
We have almost 20 million units that get transfused, and we have very few patients, like 20 a year, that die from unusual antibodies or occasionally errors. And it's like the airline industry. We have extremely high standards of quality.
So 6 sigma is a quality process?
Yes, it's a quality process that examines, you have to have duplication and precision and accuracy and double checking and preventing things from going wrong, because you wouldn't want to be on an airplane and not make it.
No doubt.
And the same in a hospital.
Wouldn't want to have a transfusion and not have the right blood type or something like that. I understand. You also mentioned, I don't know, before we leave the international realm, if there was any particular comment you wanted to make about other labs, and please do if you do, but you also mentioned that you have a training component, and I'd love to hear a little bit about that before we wrap up.
Yes. All the team leaders have to have additional training to what team members have to have. So many hours of training. If you do it face-to-face, it's a whole day training. If you do it on the web, you can do it at several times, but it takes about several hours just to be a general inspector, and then you have additional training for certain for the areas that you're involved in, and this training has to be repeated at least every 2 years, and people are not allowed to go on inspections if they're not trained.
Do you also train at the laboratories where you visit? Is there a continuing education component to what you do?
Well, when we inspect, there is a continuing education component, but that is not formally structured as such. Our own lab and our own people do train constantly. In addition, we have continuous medical education, and we have laboratory education in addition to laboratory training, because you need to have expertise in the area that you're involved in.
Dr. Baltaro, thank you so much for joining us today. It's been a pleasure. I'm hopeful that if you come back this way to Chicago in the future, we'll have a chance to talk a little bit more about your own background in pathology, some of your experiences in that field. No doubt after 30 years you have some very interesting things to share. I'd also love to talk to you a little bit about the process of educating in pathology. We have been joined today by Dr. Richard Baltaro. He is professor of pathology and an educator at Creighton University. He is a physician in pathology, and also is responsible for traveling around the world and accrediting pathology laboratories. You have joined us in this segment of On the Edge, Conversations in Medical Sciences Research. If you want to join us, you can join us by going to your email on the internet and typing ask@intimetv.com with any questions you have. Real quickly, do you have a website you want us to visit?
Yes, www.cap.org, and you can click accreditation and laboratory improvement, or laboratory accreditation program.
Excellent. Thank you so very much for joining us.